Can I get a thumbs up or somebody come off mute if you can see my presentation? Zoom.
Hi there, and it's Crystal. I can see it.
Okay, perfect. Thank you so much. Well, welcome everybody. This is our presentation FCS presents on Medicaid documentation, a really core component of the FCS services that we provide. So definitely have a lot of information to go over and really encourage folks to, ask questions, provide comments. I'll do my best to juggle between those. So my name's Darren Paskey. The FCS Supportive Employment Program
Okay,
Manager
I'll talk
with
to you later.
Bye with the HCA.
Love you too.
Part of my role is providing trainings. I specialize in supportive employment services and
Stop.
definitely FCS.
No, she's off the phone.
I'll just ask folks if they can mute.
Nobody's on there. She's gone. She's not on there.
Hey, Crystal, you're unmuted.
I'm sorry. My daughter probably unmuted my mic. Thanks for letting me know.
Perfect. Thank you. So definitely documentation is a core component of the services we do because it's definitely a billable service through Medicaid and foundational community supports. And we want to make sure you have the right tools to use to make sure you're in compliance with Medicaid and in the guidance of our third-party administrator, WellPoint. Definitely some programs I work with have electronic health record systems. I think that's a really great strategy to provide those supports. And I know some agencies are just starting out, so they might have, more of a paper and note and binder mechanism. Both those can work, and both have the strategies. Definitely, I know it's a cost savings when you're starting out providing services. There we go. So these are some of the things that we'll be talking about today. There's a lot of free resources on our Pathways to Employment website and Pathways to Housing website. A lot of the information I focus folks on utilizing comes from our IPS Learning Center. I'll have to take a break and put some a slide into the chat that has some of the active links for people to go and get access to materials on those sites. So definitely these are some of the things that I hope are familiar for folks, but definitely there's opportunities to add a lot of information into your current documentation process. It's great. Looks like we got a lot of folks from a variety of places. So great. Everybody's able to join today. Along with doing good documentation, you also have to be aware of some of the potential hazards out there in terms of making sure you're in compliance and having documentation that meets the expectations for medical necessity. And those are some of the things that we'll be talking about today, as well as some of the framework for notes. And I know there's a lot of different notes online, DEP notes, SERP notes. There's a lot of different varieties, but a lot of it is that intentional piece that you're capturing the information and have getting some information from the participant and have a plan for action for what you're going to follow through next, and that there's, the identifying the participant as well as identifying the staff member and time and location of the services. So it's always good to have some backup documentation in terms of maybe you're going to request services through WellPoint to ask for exceptions to the rule so that you can add some hours, or maybe you're in a situation where you need to support the person more and you might need to add some documentation to kind of tell that story of why you need additional service hours to support the person in their employment or in their housing goals. We really have to be careful if you have multiple funding streams that you're keeping your documentation and services separate. An example would be somebody's working with somebody who's eligible for housing and employment. You can do both, but you can't do both at the same time. So if I was at your agency and in the morning we're talking about housing services, that's a daily rate so that you could create a specific note to show about goals for independent housing and what we're doing and some of the plans that we're doing and maybe some landlords or some facilities we might meet with. In the afternoon, then I could meet with a supportive employment staff, and we're going to really focus on those types of things, maybe outlined in the career profile, work on a resume, maybe look at some of the job references I have, those type of things. So you have a note that you're developing at separate times, separate content, and attached to different goals within your individual service plan or your SMART goals for the notes. Folks who are also contractors with DVR, maybe you're a community rehab provider, that you might have separate contracts to do community support, independent living, or job search. And we just have to make sure those services aren't happening at the same time with FCS. You have to be very distinct in your services. And if you're focusing on VR services through DVR, then you also want to look at those other FCS services in the pre-employment or employment sustaining services that we can use to support the person to get to their goals, employment. And it's always a good idea. Definitely within IPS, I think there are more standards for data collection and some systematic job development processes about collecting data. I know both supportive employment and supportive housing has information on the pathways websites that kind of focus on tools that help you collect data. At the IPS Learning Center, they just launching a brand new tracker to help supervisors track people who are on caseloads, track people engaging with folks in the community, tracking supervision, all those type of activities. There's actually some courses coming up and some office hours that IPS has around those services. This is a really intense slide, so I apologize. Ahead of time, there's a lot of information here, but it's some of the trackers that are available that we can share with you in terms of just starting that process so that you have the ability to see who's on a caseload, track each staff's caseload, and then kind of see what they're doing in terms of, are they completing a vocational assessment? Are they going out to engage with employers out in the community? For IPS, for high fidelity, we're really concerned about that time frame. After the career profile, does it happen with 30, 60, or 90 days after that? We really want to be intentional in services if we're talking about employment as well as with housing, that if we're saying we're going to help people, we want to be able to show that we're doing that. And some of these participant logs and data trackers is a great way for supervisors to manage caseloads and also share with your leadership in terms of activities that people are doing in the community. Maybe you can add a column for people achieving interviews or, accepting interviews. Maybe you're going out and providing job coaching in the community and working with employers. All those different things can really be valuable data as you try to support your program and keep providing the services, and also maximize some of the services through foundational community supports. How many people are currently, FCS providers right now? Maybe just kind of click on hands up or something. Thanks, Kim. You're awesome. That it's also good to track those authorizations and see where you're at and how many you're utilizing a month or that 6-month period. Because if you incorporate that into this log and tracker, you would be able to be asking for assistance from WellPoint if you need exceptions to the rules, to ask for some more time, or be able to manage and monitor caseloads, and also help with your billing, because that's an important part of the life we live in, is making sure we have revenue coming in to support the program so you guys can continue to do the great work that you're doing, helping people be more independent out in the community. So we're just going to kind of do an overview of some of the FCS services that we're talking about. We're going to jump in and talk about employment first. As you can see, employment and housing both, we're really focused on how we're developing those relationships with people. And a lot of that is that first encounter, and really encourage employment providers to use the career profile on the IPS website so that we can start that process and kind of learn a little bit more about some of the struggles, maybe some barriers people have experienced in the past and what some of their goals are. Maybe people aren't really sure what they want to do, and they might look towards you as some ideas of things that might be potential out there. Uh, when I had an employment service program managing the team, I would always have my teammates share with me some of the things that are going on in the community. So when I did initial orientations or I was able to meet with folks, I could share some of the things and information about some of the employers that we had a relationship with, just to kind of give people an idea of some of the job goals that might be out there. Sometimes people come with emergent job goals that they needed a job last week because they're having trouble paying their rent or they have some obligations that they need to meet. We can work on those as well as we can work on some of the long-term goals that might take some training, some education, or a little bit more research to find that good job match for somebody in that situation. We always want to focus on that individual perspective. And honor those choices. Sometimes it might take a little bit of time on our end as a specialist to kind of do some research and provide some feedback to folks. I've met people who come in with some great dynamic ideas. Maybe they want to be in justice involved, legal services, or maybe they want to be in an industry where you need a certified driver's license, like a CDL or something like that. But maybe they don't know the different requirements and the health issues that might be around that, or getting medical clearance for some roles. So there might be some research we have to do, but that's all part of that process of building that relationship with somebody that we're taking their goals, and then looking at some of the opportunities out in the community. And we really want to focus on that individualized process, that we're going out building relationships with employers so we have a better understanding of maybe some of the restrictions, requirements, how people go about setting up interviews, how people apply, all that general information, so that we can bring that back to our job seeker participant and give them some information, and then work hand in hand to best prepare them to get their resume ready, to complete the application, and hopefully move into an interview with a company. Within the FCS Foundation's services, we also have what we call job carving or customized employment. This is where we might have a great relationship with an employer and we can customize a position to meet the needs of the employer plus the participant. So maybe reducing hours to 12 or 15 hours of work, or maybe talking to other staff or other people in the business and seeing if there's some job duties that maybe they could hand off to somebody else to kind of create a unique position within a company. Definitely it takes that ground building and strong relationship with an employer to be able to kind of go in and do some of that assessment to kind of come up with some creative ideas that could be a potential job for someone. Whenever we talk about employment, I always like to really focus on educating people about their benefits. People here, your participants are going to be on Medicaid, and there's going to be some changes in the federal government to how that will impact our Medicaid participants. A lot of things will be unraveled over the next year. So definitely there's already some, things going on in terms of looking down the future and being aware of how earned income can impact benefits. It can impact your Social Security, can impact your Social Security disability, it can impact your Medicaid, your Medicare, many things, veterans benefits. So people really need to be aware and educate folks, and have that conversation multiple times. I've seen where people say, "Oh, Darren, I know what I need to do. I know about everything." Well, are you aware of work subsidies? Are you aware of work incentives? Are you aware about reporting requirements when you go to work and what you need to report to DSHS, SNAP, or Social Security? A lot of people may not really want you as uh, a program specialists to get into their financial business, but it's a conversation I really encourage people to have. I've worked with people who tell me that they have it all covered and they don't need my help, and then they're faced with an overpayment. So when you go to work and earn income and receive your benefits from Social Security as well, um, they're going to want their money back. And in terms of when they request that through an overpayment, they usually ask for it all at once. And it will take some advocacy to be able to make that manageable for folks. I think I ran into one person during a review that he had gone through an overpayment process and he was able to work out a payback process, but it was over like 20 years. Definitely, I'm not sure that can still work with the current administration. They've been really focused about changing some of the rules and getting that money back into the Social Security program as fast as they can. So definitely, there's some great trainings out there. And if you have some need a consultation or reach out for some resources, I have a lot of new resources on our Pathways to Employment website, and you can also reach out to me to chat more about benefits, specializing counseling. Definitely, I'm pretty passionate about it, but I know how much it can impact somebody's life or even the family's life who's involved with that. We talk about transportation. As a separate service because Medicaid doesn't currently cover transportation as a medical service. But if you're conducting some windshield time and working with somebody and maybe talking about skills and abilities for an upcoming interview or do some practice interview questions with somebody or kind of checking in to see how they're managing some of the challenges in their life or talking about their depression or anxiety. All those can be crafted into that medical necessity note. So just be cautious about that. The Medicaid FCS does not support or provide reimbursement if you're just driving from place A to place B. But if you have somebody with you in the vehicle, you can definitely craft that into that engagement piece. Um, both models, evidence-based practices, they're all about building that rapport with somebody. And it's also about building that relationship so that we could do some advocacy out in the community. When we talk about employment and housing, both support education because I've learned that not everybody is ready to go back to work. Some people want to complete their high school diploma, or some people want to complete those credit hours to complete their degree. So there might be some different ways that we could support them looking at educational goals, maybe helping them acclimate to a college campus, or helping somebody with their FAFSA, or maybe just connecting them. Where do they need to go for student services? What would be the process if I could help somebody advocate for some accommodations at school? So there might be a variety of things that we can do to give some guidance and support and some problem solving so people can be successful at school. A lot of employment services and housing services as well is learning about the person and then start identifying those barriers. What do the barriers look like? And maybe there's some strategies that have worked in the past to help somebody move forward, or maybe there's some strategies that haven't worked in the past so we can avoid, having somebody go through some of those experiences again and be successful. So we really want to learn about the folks, and it takes time. I really encourage people to start this process, but don't think it's all done in 30 or 60 minutes. It really takes some time to build up the relationship with someone. During fidelity reviews, I've seen people complete the career profile in like 30 minutes or less. And I really encourage people, it's not a race. You can do part of it with at one session and then do a follow-up. Those are all billable services under FCS. So you can definitely take your time to build up that rapport with somebody and really get to know them, or maybe even spend some of that time in the career profile getting to know the family members or other support people in their sphere of influence so you can build those natural supports as you're going through the process. Evidence-based practices also talks a lot about that collaboration, that we don't operate in a vacuum, that we really want to share what we're doing with our other teams. When I was in a behavioral health organization, I would work with therapists and case managers and the crisis team and doctors and the SUD team and child and family. So there was a lot of pathways to support updates about what we're doing. I was always making sure that when somebody's getting close, to job placement, maybe they're having some successful interviews, share that with the team so everybody knows they're progressing. Depending on ROIs, if you work with folks who are separate from your organization, but it could be important to give them updates. Make sure you have the ROI to be able to share that and that the participants on board with that. Any thoughts or questions about some of the pre-employment services? Great. Oops, I went one too many. There we go. So when somebody starts the position, there's also those opportunities to provide support. So what can we do to help them keep their job or stay in school? So some of that might be career advancement. I've seen situations where somebody starts a job and they have some high skill levels and they could fit into another job within the company. Or sometimes they say, Darren, this isn't really what I thought it was. Maybe I need help finding another job. And FCS and IPS both embrace those strategies that we want to make sure the job match is a good one and that somebody's, being able to perform the functions, but they also like where they work. That can be huge in terms of retention and longevity for somebody. And applies to school. Sometimes school goals can be longer in terms of how many credit hours or how many semesters or quarters that they have to complete. So definitely have some plans for some of that long-term planning and support for folks. Both education and employment, there might be times people are going to ask for accommodations, or they're going to rely on you as an expert, maybe to do some research if there are some accommodations, or maybe some assistive technology that could help them improve their job functioning or just have being able to start a position. For assistive technology, I really rely on the experts at the Division of Voc Rehab. They're professionals in the disability community, and they'll have access to some of the technology for that. That's covered through DVR. Division of Voc Rehab is going through a lot of changes right now, so definitely they're closing some of their priority levels for folks and in order selection, so it might be harder to access some of those benefits for folks. But part of our role of a supportive employment specialist is to do that research and kind of do that advocacy out in the community. We also want to encourage folks under FCS that you can do job coaching. Sometimes people need a little support to learn a new job or just learn about how to interact appropriately with coworkers or with supervisors. All that can come under job coaching. And maybe that's going to happen at the work site, or maybe you don't have an ROI and the person doesn't want to disclose that they're working with a supportive employment program. And so maybe you have to do some of those offsite things in terms of talking about interpersonal skills and talk about how people are concentrating and talk about some of the challenges somebody might have in learning a new job. All those things can be really critical in terms of providing those long-term services for folks that we call, job retention, ongoing follow-up supports. Hopefully with folks having earned income now, they can use some work incentives to really start building their asset development, maybe save some money and maybe save towards some things that they have wanted, to get. So definitely having a paycheck, doing some budgeting, working with them in that capacity, can really help build their asset development or look at maybe some other programs that they could be eligible for, like an ABLE account, so that they could take some of their earnings and put them into a savings program and not jeopardize some of their Social Security benefits. Any questions about supportive employment? Let's look at the chat. Great. Thanks so much for putting where you folks are from. Looks like quite a diversity of demographics today. A lot of variety of agencies. Next, we're going to talk just a little bit, about the housing side. And there's a lot of similarities. They're both evidence-based practices. So we really want to see, some of the specific things that we can, interact and support our participants. Just like with employment, there's going to be those initial assessments that we're doing to capture some of that information so that we know a little bit of background with folks. Sometimes people are guarded, so maybe it does take a couple times to get that relationship going where people are willing to do some sharing of more information to kind of capture that information, particularly about, some of the things that they've done in the past and some of the things that they'd like to do in the future, particularly was what type of housing are they open to, or what does their dream house look like? And maybe there's some stepwise progressions that we can work towards to move forward with that. With employment and housing, there's always that coordination of care to really look and talk with other folks that we're working with. With employment, I talked a little bit about Division of Voc Rehab. Housing, you might also talk to ALTA, which is now HCLA, some of those specialist team members in terms of working with some housing options that maybe people could be eligible for, but was bringing in those other specialties folks that they could apply for different types of housing. So it's always good to, maximize your coordination of care with folks with either program that you're working with. And again, that collaborating with the community so that we know where their supports are, or maybe with the resources. Just with talking with a lot of constituents right now, resources can be really tight right now. So people might need some extra support and that extra creativity to kind of bring people together to get the support that they need. I talked a little bit about treatment planning. This is kind of that individualized service plan, the SMART goals, a treatment plan, whatever that is at your agency. That's kind of the guiding force or the roadmap of the services we're going to provide, and to ensure that the services we're providing tie into that service plan and is documented within our per contact notes. So definitely, it's always good to have a couple goals. I would always have some short-term and long-term goals. I don't encourage people to have too many goals because then it's really hard to align your services to the multiple goals. So kind of you can keep it simple in terms of short-term and long-term goals, and then make sure the services align in that way. Again, both programs do a lot of advocacy out in the community, and with housing is building that landlord liaison, building those relationships, and again, building those relationships and that trust. When I was in employment, people, I would reassure them, if things come up, please call me, let me know. I can come in and do some support on site, or I can do some encouragement and work with the participant. Same thing with landlords. When people are transitioning from unstable housing, from no housing into housing, it can be really tough for people to adjust, if they're not aware of some of the expectations or maybe some of the rules that might be in the lease. So definitely there's some that advocacy and education that we want to provide folks as they're making that transition. And again, financial skill building, benefit education. We really want to make sure that we can, do some of the grassroots building, help people with a budget, help people with planning, how they're going to pay their bills. It's some of those things as we're talking about housing, or even come up with deposits that can be really important for folks. And if people choose to go to work, then we have to look at see how earned income can again impact their housing benefits, as well as Social Security, Medicaid, and potentially SNAP benefits. Housing really mirrors employment in terms of what kind of things do we do to help people once they're housed? Are we still providing that coordination of care that people might need? Are we talking about how you're going to spend your time now that you're housed? Are there some things that you would like to do, like to try? I've heard some programs that people are really interested. Well, I have free time now. I've always thought about going back to school. This is a great time to look at ways and look at the resources to help people make that transition. maybe there's those folks who are going to need a little bit more support with independent living skills, how to do some cleanup, how to, mix bleach and water, how to wear gloves so you can be safe with that, how to make sure you're using a shower curtain, or if they have a shower curtain in the unit, to make sure that's closed so that they're not getting water all over the floor that could potentially, drip down into your neighbors down below, or just keeping up on routines to make sure they can keep their house clean, or organized too, in terms of ways to help folks with that. And again, more advocacy. Definitely people with living skills and ADLs, Alta HCLA can really help with that. So there might be some other partners that you can work with in terms of providing some in-house supports and maybe some independent living skills with that. And again, making sure the services are coordinated, that they're in the treatment plan, whatever we're providing out in the community to our participants, it's already in that treatment plan goal. And retention, people are really excited when they move into a place that might change. So it's always good to have that connection that when people get housed, that we're still providing some intense services just to kind of see how that acclimation is going. And that might take from 30 to 90 days. But it can be hard because sometimes people get the resources they want and then they're ready to ghost you. And they think everything's good now, but really use some assertive techniques to make sure you can do some of that follow-alongs support. And also working with the landlords just to make sure when somebody's moving in someplace that you have that ongoing connection to make sure things are okay, and maintaining those contacts so that they can reach out to you for support if things become challenging with a resident in one of their units. So that's a quick overview of all those FCS services. So that's kind of like a funnel coming down to really focus on some of the next steps about documentation. Some of the things that we talk about, and I think I've already mentioned some of this, is how do we keep our services intentional? Do they match what we put in the service plan? Do they match some of the goals that somebody might have? Um, Are we saying what we're doing if we're going to meet with people and tell them we're going to collect resources? Are we going to actually have those resources so that we can share with them when they come in next time? Are we on time for our own appointments? Do we have a strategy to see everybody a week or, twice a month, whatever that schedule is, just to make sure we can honor their time and be on time for those appointments and give them the time that they need to make some of these goals come into reality. It's also important to remember which code you're using for employment. So employment has the pre and the post services. So we definitely break that into two codes for those services. Housing a little unique because it's per diem, so it's a daily rate. So both those services fall under the one code that you see here. So it's always good, particularly if folks are enrolled in both services, that we're utilizing those separate codes for the services with different timestamps and durations to make sure that we're really keeping the billing and the documentation separate. And we'll talk a little bit about the golden thread as well. Are people familiar with the golden thread? Something they've heard of, some of the trainings that they've gone through. I know we had Rutgers University do a great series under our last contract. So definitely there's a lot of great resources on our YouTube channel. So definitely you can check some of those trainings out if you want a little bit more information. And we're going to try to incorporate some of the golden thread into this training as well. So I talked a little bit about that intentionality piece, that we really want to, maintain that purpose and the drive, that we want to show that, that medical necessity, those health related needs are being captured in our notes. They should have a specific outcome or maybe a follow-up piece. Maybe you're in that process of working with somebody that is looking for employment, but maybe they're not really sure what kind of job. Maybe they were thinking about part-time employment. Maybe they're talking about full-time employment. Maybe, working in a factory, whatever it is, kind of start to look at some of that content and how that relates to the individual. Because my philosophy is we're here to do a service to really help someone. So is there some deficit or some challenge or some barrier that we need to work on that we could lower that to make somebody, higher functioning in the community, less anxious in the community, feeling more proactive and have a sense of purpose working with folks. So I always wanted to kind of tie in maybe some of those challenges that somebody might have. Uh, Anxiety. I know I'm still struggling with daylight savings times. It's really super dark in the morning. My mood has changed. Maybe there's some of those sleep pattern things that have changed that's going to make it a little bit more challenging for me to share information or to even make morning appointments. So there's some different things that we can look at in terms of some of those social related needs and incorporate some of those things into our documentation. And we really want to strive that whatever's in that, service plan, that's what we're matching our services. That, I'm looking for work, I'm interested in work. Hopefully that's on the, treatment plan. It doesn't necessarily have to drill down that, ooh, I'd love to have a job at Amazon, but maybe it focuses on that part-time employment, working in customer service, working in tech, or working in a warehouse. Something can be general like that. um, because that service plan really drives the services. And when we come in for reviews, or if somebody else came in for administrative reviews, they'd want to be able to see those connections through the service plan, through that individual documentation, and see what the outcomes are so that they're all kind of woven together for continuity and consistency. We talk about intentionality and being purposeful. It's just like um, on this example, people go out. Well, I go check out on Bob. You know, what does that really mean? Are you just intentionally, is this just a social visit? Sometimes I've met people in the lobby prior to appointments. Maybe they're seeing somebody else, or you're have some downtime and maybe some just doing a social check-in. That's not really a billable service because it would be really hard to draw in some of those uh, social determinants of health to create known. But if you're going to be more specific about, how he's adjusting to life in his new apartment or life in a new job, and maybe there were some goals or some homework that you assigned somebody to do. Between your appointment and the next one, you can include some of that. Did Darren, make a list of employers that he wanted to see? Or maybe, in this example with Bob, maybe one of the goals was to like say hi to a new neighbor or say good morning to somebody, that you can incorporate some of those things that would focus on those interpersonal skill development, and trying to help Bob be a community member. And the first one here where it says like, oh, I'm just dropping off Mary's meds. You know, that's great if people do that, but how do you make that into, a billable note? What is the barrier that you're coming in to provide to support Mary? You know, is Mary agoraphobic and she's not able to leave the house? So it's part of the treatment plan that we're going to provide some support and build that relationship until maybe she could come out and visit the pharmacy. Um, those type of things. Maybe there's some issues between conflict and her doctor. Maybe explore some of those things that the person might be feeling. A lot of the documentation, in my experience, is that we really want to capture where the person's at. We talked about person-centered services, but we also have to be able to engage with folks so that they feel comfortable sharing information, some of the challenges, some of the success, maybe some of the things that they're really concerned about, or maybe they're afraid of in terms of building up that relationship so that we can look at those different things as we're providing services. I've seen a couple of agencies, they had a really cool program that they were able to go out and provide food baskets, to some individuals. And I thought that was a great way for engagement. But if you're just going and dropping off a food basket, you might be, focusing on some of the nutritional needs of the person, but it's also like a great way to start engaging to see how they could, change and maybe engage with the food bank, directly. Or maybe sometimes with employment, I've had to help people go to a food bank and it was part of the plan that they could have some nutrition for lunch or access the food so that they could have lunch during that first week and provide some of that support and then fade back so that they could become more independent in doing some of those tasks on their own. So we talked a little bit about just with that last example, what is the intent? Is the intent just to say hi? Or is the intent, to do some engagement so we can really find out how somebody's feeling, what their mood is? How would they rate their mood? Some of those things you could capture and put into your documentation as well. Maybe there's some outcomes we're working at, maybe it's going to as a supportive employment specialist, you're going to spend some time just to help Darren, decide to go pick up an application at Safeway, or maybe just visit one place that he would like to do. That could be one of those homework assignments, and then you could kind of see at the next meeting how well done I did. Maybe I never left my house. And maybe there were some issues going on that, resulted in my ability not to leave the house. Maybe due to anxiety, poor sleep, whatever those different things could be. Those could be all some of those social uh, pieces that we could incorporate into some of our documentation and really support that medical necessity piece that folks have. You know, uh, Maybe my sleep hygiene is really messed up, and I could get some help with that through ongoing services to really adjust my ability, like not to have caffeine in the evening, not to stay up too late, some things like that. We could use benchmarks to kind of help change my behavior that might match a potential work schedule for an employer that I want to work with. Sometimes it's really tough. Does anybody have some situations they've had where it's been really hard to engage with folks? Episodes where people ghost you and they don't call you back or they no show for appointments. I've had some times where I've actually gone to people's homes and, you have that sense that they're there, but they're not going to answer the door. What kind of strategies have people used to try to keep people engaged? And put something in the chat if you don't want to come off mute or raise your hand. Definitely, probably raising hands not good. I don't think I can see all that, but definitely I can see some of the chat. Yeah, constant locations. It can be really hard if somebody doesn't have some stable housing or, some place where they go on a regular basis. That can be really challenging.
Can I mention something? Hi,
Sure.
this is Courtney Lara. Um, when I meet with my members, sometimes it's a challenge of them wanting to come into an office setting. So, what I've noticed is if I meet them where they're at, like if they are already housed, maybe meet them at their house or in a public setting. It seems like they feel more comfortable that way, and then they engage more with me with that.
That's a great strategy. Definitely making somebody feel comfortable. Sometimes I think that's half the battle in terms of meeting with people to make sure that they feel comfortable. And I think when you're in that atmosphere that they are, then you can go ahead and build up on that relationship. Yeah, go ahead, Patrick.
I'm his partner, Annette.
Okay.
I'm doing another thing on my phone, and like he had to run out the door, and like you were asking a question. I was like, "What was that question?" And I tried to run over here. Can you repeat your question that you
Yeah,
just
it's just
asked?
in terms of strategies to keep people engaged. Sometimes it can be really hard building that new relationship. Uh, Not everybody's always engaging every day. So if there's some strategies that you've used to help people feel safe, be comfortable, to kind of help with that relationship development.
You 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 pick one of the things you listen to their body language first of all, because some
Mhm.
people don't want to hear your struggle too. But I'll use an example when I used to work at a gas station when the pumps weren't working, right, and the customer's mad. You just agree with the customer, like, yeah, the damn machine, like they get you every time, like you try to understand, like, so they're not thinking they're alone in their struggles. Does that make any sense?
It does. I used to work in a restaurant, and my manager would always say, make the customer happy. And, that always didn't make sense to me because some people didn't come in happy at the restaurant all the time. So it can be really tough kind of having that situation where you want to,
Oh,
it
I was very
works.
good at it. I love getting apologies when they're mean to me. I'm like, it's a score. But that was a while ago. But yeah, for when you're working with like mental health and like housing, like what a lady just said, meet them where they're at. And
Yeah.
sometimes the meeting where they're at is like a for people who know what that means and who struggles, like we're houseless, we're not homeless. It's like, thank you for meeting where I'm at, but I need you to be on that next level so you can help me get to that next level. So
Yeah, that's a good way to put it because definitely we have goals and we're
it's
working to help people on the next level. I saw Kim even put in the chat something that you were sharing. It's just like, focus on what the person wants, not what we think they may
I
want,
know.
need, so that we're kind of aligning the services. Um,
Sorry, I took off the camera so I can hear you. That's the only
well, great.
reason why. If I take off the camera, I can hear you better.
Okay. Well, thanks for coming off mute and sharing. I do appreciate that. And thanks for folks putting some of the things in the chat. I think a lot of it is if people feel respected and having that process honored, my experience is that they're going to open up and share more, and then we can understand the barriers more, understand where the person's at, and support their needs directly. And then I think it's also easier to kind of form documentation notes that we can say specific things that we did or specific strategies. We just talked about active listening, listen to the person, active listening
Being heard.
and to support their employment goal or support their housing goal. Or sometimes we need to do active listening just so that we could understand maybe where somebody's at, some of the pain that they're experiencing, or some of the fears that they're experiencing as well.
A lot of people really want to just be heard. So sometimes they really like just have someone listening, actively listening.
Yeah,
That's like the biggest thing that most people are asking
it
for
could be a
without
challenge.
asking,
I
I
I
guess.
know I used active listening a lot, and when I started out in social services, I thought I was doing that well, but I think it took me some time because I was really driven what I thought people should be doing in terms of employment, but definitely working with them and then learning more about their skills and abilities so that I was more in tune to what they needed and what some of their desires, but also be aware of some of the barriers and challenges. Uh, yeah, being truthful. I think that's really important that, I would never want to oversell or promise something that I knew couldn't take place. Definitely working with some folks, I think it's good to be honest and always being truthful in what you do and having some humility as well.
It gets them to trust, don't so you don't break their trust. But when you break their trust, you just lost the whole commitment of working together.
Yeah, it
So
could take
I
some
mean,
time to repair that. You're
yeah,
absolutely.
I'm gonna give you the hat now.
Thank you for the additional information and sharing. So this is kind of just being honest with folks. Definitely, we do the work. I did the work for passion, still doing the work for passion and seeing people's lives change and be more independent, autonomous. But also, you know, the services we do in the documentation we provide keeps our doors open. And I'm a believer that we really need to keep all the doors open for service providers. Unfortunately, this year, I think come across 3 different employment programs who, have closed their doors. So that just means less resources out in the community for folks. So definitely some of the things to consider, that what you do is kind of related to billing because exactly the service codes that we use and for employment that we're billing, WellPoint for, some employment services, we want to make sure the documentation that we have supports what we do and using the individualized service plan as part of that, telling that story so that people can really understand some of the things that we're working on together. Some of those things, definitely for employment and for housing is time management. How do we manage our time? And then, collateral services. I definitely want to encourage folks to think about this because that allows us to go out in the community talking to employers or talking to landlords. And maybe we don't have the person with us, but we're going to talk on their behalf. So we can learn about maybe what a landlord needs in a tenant, or maybe learn about the hiring process with an employer, whether it's Safeway or Costco, Amazon. And then we can bring some of that information back so we can share, so we can build that, plan for employment and share some of that information. And definitely I've seen in the chat and I've said it, sometimes people are hard to engage with, but we need to understand, maybe what's going on. I've had some people that I've had engagement with and then it breaks off, and kind of, just letting people know this is a safe place for you to come when you're ready. We're just concerned about your safety and your welfare. We want you to be successful, and we want to be part of that process. So sometimes there's a little humility in terms of, sharing, and having some of that patience for understanding as well. Yeah, Dre, I think that's a great way to look at it. People are in the driving seat, and trusting relationships can be really powerful, but they can take some time, to develop. And I think for me, that was that intentional services that if I'm saying I'm going to help somebody with employment, I'm going to demonstrate some different things to really reinforce, the employers I'm working with, maybe doing some research, about wages or training or whatever that looks like, so that I can come back and say, this is what we're doing and this is how we can work closer together. Oh, Claire, you have a great question. Would you want to come off mute to share that?
Hi.
Thanks.
Um, we just have a question about collateral contacts, whether it be a landlord or something similar to that. Obviously, we would like have the members' permission to be speaking on their behalf or getting information on their behalf. But as far as that being a non-billable or a billable, do we have to speak to them that same day in order to have it be a billable, or can we just have that collateral be a billable and then update them the next day? I'm just
You
with like
can.
people who maybe
That's a great
aren't.
question because sometimes, like maybe I found an employer and I want to communicate that directly. I'm not able to get to hold somebody,
Right.
But, I would just put in my note, my plan is to update them at our next regular check-in, plan to update them by the end of the week. I think it's always good to put that caveat in there. If you found some information
Okay.
and you want to share that with the person you're advocating for, just put that in the note and, plan follow up next week, follow up by the end of the week, something like that. Great question. I do want to kind of check in with folks. It's kind of wonky, but like, are people using that collateral note as part of their strategy for engagement with employment and for housing?
Can you define what you mean?
If people are actually using that as a billable service, the collateral notes that you're going out and engaging with landlords, you're engaging with employers just on your own without the person being there, that you're using that collateral strategy as part of your service modalities of the service plans. Oh,
I know people are. So
I think it's underutilized, but definitely I think it gives you some flexibility. Definitely when I was working with some of my team that sometimes you have appointments in the community and the other person, your job seeker doesn't show up. Well, what do you do with that time? And that's a good time. I would educate my team to start doing some job development. You're already out in the community, pivot and kind of focus on, some of those job contacts you might have thought of or follow up in some of those general job goals. And I'm sure you can do the same thing with on the housing side. Paige, that sounds like an incredible story. That's a lot of work. 13 jobs. Wow. And sometimes it does take, some of that extra time to really find, that job match. I've worked with folks. I don't think I've ever had that many. So kudos for you for hanging in there and providing that ongoing, nonstop support. But people can start and stop jobs. Some people are excellent at getting a job, not so good at keeping the job, and that can be really tough. I think it's tough on employment specialists as well, as being able to kind of pivot and regroup and support the person. So definitely kudos for you.
Yeah, it was really difficult because he would identify things that he wanted to do and
Hmm.
we would talk about it. And then when he actually got the job that he wanted, he just learned that while it sounded good in theory, in practice, it just wasn't for him. So over the last
Yes.
year, he had like 13 jobs before
Wow.
last month got one that he's been doing so amazing at. It's been amazing to see him actually thrive at something instead of
Yes.
continuously second guessing himself about what he wants to do.
That is so true because I know I have a critical editor that kind of gets interferes with my life, and I think other people can have that too. With some of those failures can really darken, somebody's future and really focusing on the positives. I had somebody who wanted to work outside, so I got him a job putting pallets together, and it looked like it was going to be a pretty good job. But when I was helping him out there that there was a lot of external noises going on, which was really detrimental to his behavioral health condition. So it was a learning experience. I was helping him to find something else, but that was really hard for the person to be in a job that really did fit his needs. And I've also had people like say, "Oh, Darren, can you get me a job at Costco?" It's like, "Well, maybe." Have you been to Costco? Well, no, I haven't. I see people seem happy there and they're always so busy. It would be a great place to be. So I'd take them on a tour of Costco and, introduce them to the parking lot, the carts, checking in to get in, the lights, just a lot of stimulation. And not everybody can handle that level of stimulation. So sometimes one of my favorite things to do in employment was really being able to take people to different environments, if you're able to kind of show them the different things and maybe how things can be impacted, but also then it also helps with potential strategies for those supports that you can provide. And I'm sure I haven't had that. I've had very limited experience with housing, helping people, get and maintain housing. But I know sometimes, neighbors can be triggering, airplane noise around traffic, public transportation around housing can be a challenge in triggering as well. So thank you, for sharing some of that information. Boy, everybody's really active in the chat. So let me just kind of check in over here real quick. Great. It sounds like some people are really being productive with some of the collateral services and going out there and checking in with landlords and, prospective landlords, and then updating them. That's great. I really love that intentionality about, updating the participant with what you learned. We don't want to just keep it, in our hot little hands. We definitely want to be able to share that with folks. Well, I think a lot of what we do is networking, definitely. I agree. I think it's a great part of services. And I think that's why I've always loved supportive employment and supportive housing because we're out in the community engaging. My counterparts who did case management, their community activities could focus a lot, going to the jail or going to the hospital, going to different kind of institutions like that. And I liked going out to the schools and employers and, really seeing how people, because It might be me. I think I have a bias, but I think people are their natural selves outside kind of those formal facilities, and can be their actual selves, out in the community. Like we said earlier, meet them where they're at and where they'd like to be, whether that's on a park bench or the library or, wherever their favorite park or something that they can go out and do that. Thanks for being able to hang in as long as you can, Diana. I do appreciate people being able to hang in there with the time, and we will have this recording uploaded to our YouTube channel for future reference. So this is a great segue to talk a little bit more about the golden thread. And this comes up a lot in terms of weaving in that medical necessity, and making sure we have some core components that in some of the other examples were just not, help Darren get his appointment, or help Darren with the food bank. What's going on behind that we needed to provide that service with them. So sometimes, it is a little bit about the details that we provide or lack of details that we could provide. Hey, Patrick, I'm just going to ask if you could, it looks like your bandwidth is a little wonky. If maybe you could shut off the video. I see things flashing. Thank you so much. Glad that you're able to stay with us today. So we really want to kind of get some of those, key elements that build up a note and why that's important. This is something I think I've told my staff because I was told it when I came into social services. If it wasn't documented, it never happened. And I used to do crisis intervention services, so sometimes I would have to go to court. So it was always important that I could be very detailed. Not that I would write paragraphs about what I saw or what I was involved in or how I helped somebody stay safe, but definitely have some of those critical elements that I was able to observe and why that's important to providing support to people out in the individual. And what counts as documentation. So that's kind of a question. What do people think? What is documentation in social services, behavioral services? What is documentation all about? Yeah, progress.
Following a paper trail.
Exactly, a paper trail, that accountability, record keeping.
That's the whole point of documents, right? It's
Yeah. Yeah, sometimes it's about certificates or reports that we could get reports from doctors or maybe certificates from training or school that we could put in the clinical record as well to kind of show progress or different things we've tried.
ooh, I love the answers. Oh, sorry.
Looking at that alignment of the goals that we had in the individualized treatment plan. Or maybe Darren got a vacation and somebody else had to come in and work with somebody and they could see what interventions were being tried or what support could be prioritized in your absence. Capturing progress. I really like how you guys are really future oriented, really focusing on the progress that people are making. Ooh, sometimes it is about level of care. Good point. And that's what we're trying to do is kind of create some of these strategies to put them into, a document that's usable. I think sometimes people feel like it's a burden. It does take some time and some focus, but it's that process that you can start, and it's just like learning something new and having some patience as you learn a new system to make sure you can collect some of the elements that I've seen in the chat. Yeah, Allison.
Yeah, it's not as fun to talk about as the elements of celebration or planning, but if there's something that we see that we're concerned about and we want to document that that's something that we've been working to address with the participant, help them out with, help support them with, so that if, they have a success around that, awesome, great, we can document that full narrative. Or if things don't go so well, we have that full story of like, look, they've been getting support around this, so there's still a chance that we could head for a better outcome.
Absolutely, or maybe just a new level of awareness, because sometimes it can be really tough for people
For
even to be
sure.
aware as a barrier. And sometimes that's hard for people to acknowledge. So just that support as well. Yeah, future conversations, I think that's always great in terms of kind of being that future orientated. And not to say that we are here in one session that we're going to solve some specific things, but maybe we can kind of start building that strategy, for more independence, better sleep, better nutrition, whatever those different goals are that we could start the formulation and work towards somebody to be, in a safe and sound environment or in a productive environment as well to meet some of their employment goals. Yeah, I agree. It's kind of, it's a snapshot in time about some of the progress that we see. And yeah, it can also be a space for connections because I know sometimes I've, consulted with my supervisors. So we're looking at external partners maybe or services that we could bring into the conversation to see if somebody's open for that. Yeah, Annette. Yeah, I'm just seeing your thing about a shelter dog.
Yes, so I was trying to see what would be like what would be the counteract argument if someone like I keep sending it out to every Zoom I'm in
Hmm.
about like putting two organizations in one, helping either crime victims or any trauma induced victims or whatever, get housing at the same time that they can a dog
Yeah.
that needs love, and the two would help each other. And I'm trying to see what would be the counteract, or what would be the I'm asking the group, what would be the counteract argument of denying that? Would you know what I mean? Like,
Well, I think
if you're
this is
trying
really
to help this.
kind of outside the focus of our training today, but we could look at how you could document something like that.
Yeah, that's what I meant. Sorry. Yeah, sorry.
Because definitely, I'm sure this happens a lot. And I know just in terms of working with some shelters and some landlords, having a pet could be an issue. And when I've worked with some advocacy in housing, we could look at working with a provider, a medical provider to show that this was a companion animal so that we could help somebody get into some safe housing. So part of that would be sometimes it takes that consultation, with an external provider to see if they could get the buy-in, because I'm sure that animal provides some positive, interaction with the person, maybe feeling safe, or that they see the animal having that extra ability to decrease my anxiety or, feeling safe or maintaining my activities during the day. Because definitely I have a dog and she definitely likes to go out for walks. So kind of those different things that we could show in that medical necessity piece, why that's important, to do the next step. Definitely, I think that's a great, passionate campaign that you're working on, Annette.
Thank you. I really, I'm pushing it out so someone else can
Dogs
say
help
no to
my mental
people.
health. I think all animals help mine, except slugs.
Yeah.
I am anti-slugs.
Okay. I agree. They need help. They can need other things.
You guys are doing great in the chat. You know, forgiveness for not being able to get through everything that you guys are really creating some great ideas. So definitely, people take a peek in the chat. There's a lot of stuff coming up. Sorry, I'm not able to get to it all, but I will. I'll be able to take a look at those going on. So pivoting into the golden thread, there's these different, stages. And as we talked about, it's a lot about that engagement. And like we talked about active listening, setting up those times that people can, maybe reach out to us if we need to, or being able to meet with them in the community or, in the office. And what does that medical necessity mean? What kind of things are we looking for? Some of the things we've talked about already is anxiety, depression, agoraphobia. Maybe it's how I process information, being overstimulated with lights or noise. things like that. Maybe it's also about there's some nutritional elements that we can look at, or maybe, working with reentry folks, you have that anxiety about working with the DOC or a probation officer, or maybe in school, there's those people in authority, teachers, counselors, the FAFSA folks, that could be really hard for you to be able to work with because of your own trauma. So it's kind of in that trauma sensitivity and that kind of recovery perspective when we think about that medical necessity piece. And we talked about, and you guys have been great about pointing out, that individual perspective and the strength somebody, brings. I've met some incredibly powerful people in my work in behavioral health. Just the resiliency that people can come through some horrific tragedies and trauma, and now they're able to decide to change their lives, which can be really empowering. I always think it's good to have a couple of goals. We talked about that on the individual service plan. A, a clear short-term goal and a clear long-term goal. Maybe it's just for housing, it's being safe with, that long-term goal of having your own one-bedroom apartment, or even for employment. I just need something to make money, but I really want to have a career in automotive, whatever that could look like, in building some of those treatment plans and service plans up. So now kind of getting more into how we're going to document some of the things. And we've talked a little bit about that. So you guys are a great group about sharing information. I love that. We always want to provide good care, and some of that we've already talked about is active listening, meeting people in the community, going out to employers and landlords, doing the collateral services, provide some of that. But there's also that continuity of care. I always believe we don't want to do any harm for folks, but until we have that relationship, we might be unaware. And so maybe there's going to be those times with a little humility as we learn about people and people, learn about us and how we focus on services. Definitely documentation is necessary in terms of if you're working with Medicaid or Medicare or DVR or some provider that provides dollars for services. There's always going to be some kind of documentation, some kind of coding that's involved where you can see what the service is and see if the service levels were met, just like we talked about. Somebody mentioned level of care, earlier. Just be aware this is a legal document. And if you are providing services and you never do the legal documentation, but you do the billing, that's a big impasse in terms of how would you know how the service, what happened in the service, and how could you justify those payments, to WellPoint. So definitely as we, with that golden thread and, just coming back to this series here, everything is kind of tied in terms of how we do services and how we get reimbursed, for services. Sometimes things happen and you need to be able to have a note that says, what happened. I've been in some situations where people that I was working with felt that I wasn't doing a very good job, and that I had some bias in terms of services, but I could show in my notes those different things, different strategies, different engagements that I use to try to get to know the person and provide the appropriate services. So it can also help you, in terms of your relationship building with, your program, with your team, and particularly the individual as well. And that you can show different interventions that you've done. We sometimes it does take some time as we're building relationships with folks to try some different things to do the engagement, but it might be more than just, active listening. We're going to have to do some strategies or some problem solving or take the initiative sometimes, or sometimes we're exposed to some information and then we need to be able to work within our framework to bring in other resources or to notify other providers of some of the things. But a lot of it is going to be like if you go to a doctor, there's some of that medical terminology that we use. And I'm not saying your notes have to be full of medical terminology, but sometimes if somebody has some anxiety, we could talk to the person and kind of find out what is really, that piece that they're reacting to. So that we can use some everyday language, kind of describe the issues that we're working on and how we're going to help them overcome some of the barriers. I think it's always good to be able to have, information. I think at any agency, it's always good to have, people have access to their charts if they ever want to take a look at that there's usually a process for that in your organization so that they could do that. But you always want to be able to have clear information. And sometimes, for me, sometimes it's, keep it simple in terms of when I started out doing documentation, I thought more was better and more was more better. But that's not really how I've learned through the years of providing documentation that it's clear, it's succinct, it's specific to a certain situation, and our plan is, you know, directly related to the person and whatever issue that we talked about, that day. And again, really focusing on the person and what the person needs, because everybody might need something a little bit different to be successful or to decrease some of their anxiety or, to improve their level of mood. Yeah, Allison.
I would build on that and say that when I started out, I was very anxious about if we had laid out, like a participant and I had laid out a plan together and we, full of voice and choice, and we'd come up with it and agreed on it. And then, they have a complex life and something else came up. Initially, my response was like, "Oh no, how do I do this? This isn't to the plan we documented." And then I realized that what we do is we pivot. We are always on a swivel. And so all you have to do is just document, like, here's this demonstrated need. Here's this emergent challenge. We're pivoting. Our new focus is going to be over here. Fresh plan. That's part of that golden thread.
Absolutely. I think pivot's one of my favorite words in behavioral health. Not that I like to use it, but I think in the situation, you do have to have that flexibility and kind of change that scope of mind and scope of work because things do happen, whether it's in the person's control or out of control. I've worked with people who were really super anxious because they're waiting to hear what a court order was going to, define whether they're going to go to jail or be able to stay, in the community. So there's all those stressors behind, and we really need to you know, be able to pivot, to meet the goals and kind of outline that in the notes. That's a great time to say we've got to like change our strategy to support Darren in the community due to these, stressors. Sometimes it can be medical, something out of people's control, to help folks through whatever trauma that is. But I think that's a great way to phrase it. Yeah. I think in crisis days, we were like Cracker Jacks. Sometimes you just have to pivot to meet the person's needs wherever they're at and develop that short-term plan to get them through. And then, we can always go back to that long-term plan that's in the ISP, in terms of the service plan to work on, because things can be fluid, but things aren't always linear, and be able to have that grace to be able to pivot, like you said. So well put. Any other comments about that or perspectives?
I got lots, but I think we all agree.
Thanks for that. Yeah,
I
Trey,
had just a
I
quick
agree. Oh, go
comment
ahead.
about so someone asked about the good rule, and I was kind of going to make a suggestion of how to change that wording because I know that it's kind of like a rule of thumb that the chart, your presentation is saying. And instead of never write something in your chart that you do not want the participant to read, I've heard a really good rule of thumb for documentation is write what you are make sure you're writing what you're comfortable having read out loud at a court hearing, because at any time your documentation could be used in that type of manner.
Yeah.
So it's more about just keeping it professional. You're not writing unprofessional things. You're not writing disparaging comments. You're keeping an objective tone, right? And
Yeah.
so that's kind of how I've had it explained to me throughout my time is make sure that whatever you write down, you could be subpoenaed to read that out loud. So you don't want to say something that you're not comfortable being quoted on. And that's kind of the basis of the professionalism there, I think.
I like that. I know you've put some great stuff in the chat already. Could you add that to the chat so I could capture that later and then I could update my
Yes, yeah,
slides for that?
yes, I will do that.
I love that objective tone. Yeah, we're just being neutral. We're
Yeah, because
just
the participant might not necessarily read all of your notes ever, but it could be read in a professional court hearing. That's the
could be.
reality of what we do, right? So
It is. Thank you for sharing that. All right. So the anchor, I think, for the thread is really coming out through that treatment plan or the care plan, that we have, and that individual is part of it. I remember in behavioral health agency I was at, we would actually sit down with the person to do that because, as we said, that person choice and people being in the driver's seat, we really wanted their voice in creating that. So we would use quotes from the person as we developed some of the service plans. So I think that's really important. And I'm kind of a stickler. I think it's always good that whoever the person writing the plan and the participant both sign it. So I've worked with people that change their minds because sometimes they not feeling like the services they're getting are meeting their needs, or maybe they just want something more. So sometimes I would go back and reflect. This is how we started off the quarter. Next month, you're saying that you want something else. What can we change to make sure we're all in alignment in terms of providing the services that somebody needs? So definitely, I always encourage people to use, quotes, use the person's voice. But whether you're working on kind of a job development plan, job search plan, or even a housing plan, I think it's always good to have that person buy in because sometimes you might have to go back and reflect if things change or just the kind of that we're on the right path, as well. And also kind of think about, the encounters. Is there a need for some follow-up? Sometimes in a session, I would hear things that I said, boy, I really think we should bring in your case manager or connect with your therapist about some of these things because it definitely sounds like this is a struggle for you. And from my perspective, it'd be great if you had some additional support. So being able to have some of that flexibility to share some of that information. Yeah, Annette. Oops, I thought I saw
I
you.
know. I love that you brought that up because I'm on the other side. I'm like, well, I'm both, but like I help people get housing, but I'm houseless. I'm not homeless. I have my family, but we're houseless. But the treatment of my time management skills are out the window because of trauma.
Yeah.
I'm okay with saying it. That's who I am. And I used to be the person that if I'm not 10 minutes early, I'm late. Now, you're lucky if I'm 2 hours late because I freeze from my trauma. And having someone to help back me up or get me going, and, we really do need that. Like, lived experience people really do need that because doctor's office, if you miss up 3 appointments, you lose your doctor. And you go see your doctor because you're depressed. So like it's kind of like a catch, you're effed either way kind of thing. So thank you for bringing that up.
Yeah, that kind of gets back to, that flexibility. And I know all places don't always have some of that, flexibility, but I was always a believer in that, it's just always give people some grace, in terms of that. And there must be something going
You
on.
always try.
Yeah, try, but also finding out if there's something else going on, why we're seeing some of that behavior with folks, because it might be something out of their control or it could be something generational. Trauma impacts people in so many different ways. For that,
Thank you. Yes.
for sharing that, Annette. Do the interventions we're doing, do they match what goals are? And I'll just use this for employment because sometimes people come in and say, Darren, I just need a job. Any job is like, okay, we're gonna employment's your goal. We're going to talk about different things. And then I go out and find any job. And it's like, well, no, I don't really want that job. That job doesn't fit my needs, doesn't fit my skills. So kind of really kind of getting to focus. And this could be really hard because I've had some challenges with people kind of really getting into a goal that they're comfortable working on. But just making sure, if people are saying they're having some stress or they're facing barriers, that our interventions or strategies are really going to help reduce that stress, reduce that anxiety, that will help somebody in a certain way, not just, kind of doing some check boxes to make sure we're pointing somebody, in a direction if we know they're not going to get benefit from those services or from some of those resources. And again, you guys have been great about pointing out this. Make sure it's personal, person-centered services that we're providing, as well as the person-centered documentation piece. So just building a note, definitely there's some great note formats out there. I think DAP is something, that collects that data, the action in the plan, whatever you have, kind of what that intervention is, what the action is, and what the plan for follow-up. When I was working in behavioral health, that was something we were always focusing on. What's that next step to do? Meet with somebody, or is there something we need to do before that next appointment? So always, the structure of a note should have a clear goal. What do we see today? What are we going to work on? For stuff, are we going to work on housing, going to work on employment, the duration of time, which is really important on the employment side because it's 15-minute increments. And on the housing side, even it's a daily per diem, you have to have at least 15 minutes to start to meet the Medicaid requirements for the note. Where's this happening? Is it in the office, in the community, at the person's home, at the school, at the workplace? Those type of codes to use to be specific about where in the community that's happening. And what's the purpose of the encounter? Is it, to check up on my employment, my anniversary on the job, I just got an eviction notice, those type of things, being really clear of what we're working on today with folks. And then what's those next steps? How are we going to address that? I've recently worked with some people on evictions, and it's all about finding those resources to connect somebody and give them that warm handoff. So that could create that, medical necessity piece because somebody's in stress and trauma over getting that notice on their door for eviction and looking at specific resources, sometimes legal, sometimes community-based, to get that support for the person so they can at least look at those options to see if they can save their housing or not. And then what's the person's response? Sometimes it's like, that's not enough there, and this isn't going to help me keep my house, and maybe looking at some other resources, or maybe some people said that's exactly what I need. Thank you for those next steps. But then we also have to, like, what are we going to do to follow up the person? Like, are we going to check into them in a week? In 3 days, depending on what the situation is, always having that sense of the follow-up. And just the cautionary tale, if you say you're going to follow up in a week or a month, please follow up, because sometimes it might be just an administrative note. Tried to engage with Darren, did not answer his phone, wasn't home, whatever it is, just so you have that continuity in the clinical chart about the interventions, those actions that you did for that. I kind of like homework. I never liked homework when I was in school, but I kind of like to give some homework to folks because it always gauges that buy-in, particularly for me on employment. And it's not something like pages of homework. Maybe it's just, one employer that you would like to go visit, or maybe what kind of job does a friend or family member have that you think you would like, and they could bring that information back to me. So depending on what the individual is and what the situation is, challenge folks to see if they can bring some of that information in. I never give them like a whole page of things. I think I wouldn't like that. I think that'd be a little bit overwhelming. I've seen it done, but I think it's one of those ways to also have the person, so you're purposeful and they're kind of doing some follow through, and you're trying to develop some resources, to engage with folks as well. And at the end, it should be kind of clear what the encounter was about, and what the follow-up was. It should be pretty clear in any plan for that. Do people use a certain format, in their documentation right now? When I started out, it was SERP, it was subject, intervention, response, plan. I think that's kind of not a huge primary format, but at least it helped kind of structure in my mind, what the subject was. We're going to focus on what that medical need was. Maybe that's depression or anxiety or fear of losing your job or fear of being homeless or not having any food, in your cupboard. And then that intervention would be connecting somebody with a food bank or, some organizations have some great internal structures and resources to really help people meet some emergent needs like that. But I'm just kind of curious if people have, I don't know, I guess your favorite documentation format uh, that they utilize at their organizations. Do folks use DAP?
What is that?
It's kind of the
Oh,
data.
cat.
No,
Sorry.
DAP. No, DAP. Let me check the chat here.
Never mind.
I think that would be a great acronym in that. I just don't know what it would be like. Some kind of action in the middle. Oh, description. Thank you, Alana. I haven't used that in a while. I learned my ropes on SERP, and so that kind of always has stayed with me to this day, decades. Yeah, Clint.
Yeah, our organization uses GAP, uh, and I think that they're all pretty good. So I mean, they all have their relevance, but I think what's most important is that the organization has that uniformity. So we all use GAP, and that's so that anyone can pick up anyone else's notes and understand what's going on.
Great. Thank you so much for pointing that out. Continuity is so important. Oh, Dre, you're awesome. Yep, there they are. So, yeah, I saw Dart recently too. I haven't seen that one before. But yeah, kind of getting the basics. And I think that's such a great point. Continuity that all your organizations adapting to one. I know sometimes when a new program like FCS can come into an agency, there might be some desire to do something new. And I would say use what your organization has for continuity, just like Clint said. So if somebody picks something up, they're familiar with it, they're going to be able to kind of, see the activities that were done and have that continuity and shared throughout there. I was impressed, Dre, that you had that right on your fingertips. So way to go. Thanks for sharing that. Oh yeah, group is another one I've seen. I'm not familiar with that one. But as you can see, it's kind of like focusing on the goals. What action took place? What was that intervention? What was the person's response? I always like that part of the SERP note. And then what the plan is. So you guys are awesome. Thank you for putting that stuff in the chat. And that's kind of, the documentation piece. I think it's good to kind of see what the different formats are and being able to, focus on those different sections, to make a robust note. And as we've said, this is a legal document too that can be reviewed, but it's also a financial document, but it's also a roadmap that we're looking at how we provide services to somebody and how we're meeting the needs of the participants that we serve. If you've enjoyed this training, we have a lot more through our FCS newsletter. So I encourage everybody to sign up for our newsletter to get access to a lot of trainings. It's a very full month. The newsletter just came out, so there's a lot of information in that. We're also focusing a lot on fidelity coming up next year. So we'll definitely be putting out fidelity training in the newsletters. I think we just had one for housing and employment. So probably January, we'll be focusing on some more. Oh, nice. Blanca, that's awesome. You guys are very clever. Nice pivot. Let me see if I can put the Can I put that in there? Let me see. I might be able to, since we have a little bit extra time, because I would like to put the PowerPoint in the chat, and I'll put the FCS newsletter, see if I can put that in the chat as well. And then if there's anything that comes up, let me just put my name and Kimberly's name here. And I'll put Kimberly's email in as well. So if you have any other questions about follow-up with civic services. It. Let me see if I can get the PowerPoint uploaded.
Is that FCS participant log available on the FCS website with all those data points on it?
I think on the housing side it is. I still have to upload it on the employment side. So I think Pathways to Housing has that on their website. I haven't double checked, but definitely if it's not, please shoot me an email to do that. Krista, we can probably go ahead and stop recording, please.